She is going to present about retinopathy and chronic kidney disease and observational study.
Good morning everyone. I am Dr. Shavni. My topic is on retinopathy and chronic kidney disease and observational study. Financial disclosure and no conflict of interest. Both the retina and kidney are low resistance end organs that are supplied by very small vessels. These vessels are highly susceptible to fluctuations in the blood pressure and blood flow. The pathologic and hemodynamic abnormalities occurring in both retinopathy and nephropathy are thickening of basement membrane and increased leakage. These are the causes of chronic kidney disease, where its highest is due to diabetes, followed by hypertension. Retinal pathologies are the ones which are responsible for sight-threatening complication. With an aim of highlighting the importance of ocular screening in patients with chronic kidney disease undergoing hemodialysis, and because of the scarcity of data on ocular manifestations in hemodialysis patients, this study is conducted. My aims and objectives to study the association between retinopathy and chronic kidney disease and ocular screening in patients with chronic kidney disease on hemodialysis by analyzing the fundus changes in these patients. Materials and methods. It's a hospital-based observational study which lasted for a period of 5 months from January 23 to May 23. And my sample size is 70 patients, 140 eyes, and it was conducted in hemodialysis unit of nephrology department, KGH. The inclusion criteria is the patients with end-stage renal disease undergoing hemodialysis. Exclusion criteria is cases with reversible renal disease and not willing to participate. A complete ocular examination including visual acuity, IOP measurement, anti-segment evaluation and detailed fundus examination with indirect ophthalmoscope was done, and fundus photographs were taken. Out of the 70 patients, 140 eyes with diagnosis of CKD, 58% constituted males and 42% constituted females. This is the age-wise distribution, where most of the patients, around 54.28%, were in the age group of 40 to 60 years, followed by 31.42% who were in the age group of greater than 60 years. This is a graphical representation of the same. And the visual acuities of these patients were also considered, and here the visions were in between less than 6 by 18 to 6 by 60 in 41% of patients, followed by patients 38% of patients belong to the category of 6 by 6 to 6 by 18. The most common cause of visual impairment in my study was maculopathy, and the maculopathy was hypertensive retinopathy constituted 38% of the etiology for maculopathy, followed by diabetic retinopathy, which constituted 34%. Then the comorbidities in the patients are like the patients were diabetic, hypertensive, ischemic heart disease and malignancies were found as comorbidities, and both diabetic and hypertensive were around 21 patients. Coming to the fundus changes, hypertensive retinopathy constituted around 40% of my study, followed by diabetic retinopathy, which constituted around 20%, then mixed retinopathy constituted 18%, then around 16.4% where the patients had normal fundus. Then in the diabetic retinopathy, the patients, moderate NPDR patients were around 7 number, followed by PDR, which were around 4 patients were there in this. Then in hypertensive retinopathy, which constituted the maximum of my study, most of the patients were having grade 2 hypertensive retinopathy, followed by grade 3 hypertensive retinopathy, like 10 patients were in this category. Then coming to the discussion, the chronic kidney disease results in progressive deterioration of renal function and is independent of age and gender. In the present study, the most common retinal abnormality noted was hypertensive retinopathy. Majority of the patients in my study was having grade 2 hypertensive retinopathy. A degrading kidney function with advanced CKD can lead to increased blood pressure, and sustained elevation in the BP can deteriorate the kidney function. Out of the diabetic patients, 14 patients had diabetic retinopathy and 13 patients had overlapping features. Therefore, most of the patients with diabetic nephropathy had retinal changes. Majority of the patients had moderate NPDR, of which some patients were newly diagnosed and are not aware of the vision-threatening effects of their systemic condition. And in my study, I had around 40% who were having hypertensive retinopathy, and diabetic retinopathy were 20%. It was in coordinates with some of the studies which were like Brijesh Singh, which had hypertensive retinopathy and 30.47%, diabetic retinopathy 12.45%, Charmati study, which was Charmati et al. Study, which had hypertensive retinopathy around 45% and diabetic retinopathy 26.78%. My conclusion is that retinal changes in chronic kidney disease are attributed to the underlying etiologies of CKD, mainly hypertension, followed by diabetes. As severe hypertensive retinopathy changes are observed in the CKD patients on hemodialysis, this study highlights the importance of timely screening and regular follow-up. Patients must also be made aware of the ocular morbidity associated with CKD. A multidisciplinary approach should be advocated in the management of patients with CKD. These are my references. Thank you.
All these patients were mobile patients, or did you examine them in the?
I went to the hemodialysis unit in nephrology, sir. Some of them patients, we have another OP in the same KGH. There, I call them for anterior segment evaluation.
Yeah, no, I could see that you did check the vision. So, how it is possible to check the vision of your bedridden patient?